Hey beautiful people, welcome back to my channel once again with another topic, that is virology part 2. So before starting our video, I would like to request you to please like, share and subscribe to my channel and keep the notifications on. Thank you. So friends, today our 16th question is, the varicella-zoster virus, that is VZV, cause what disease? Option A smallpox, option B chickenpox, option C polio and option D shingles. So friends, your right answer is answer B, chickenpox. The varicella-zoster virus cause chickenpox. Moving on to our 17th question, which is the first disease to be eliminated by vaccination? Option A measles, option B polio, option C mumps, option D smallpox. So the right answer is option D, smallpox is the first disease to be eliminated by vaccination. Moving on to our 18th question, which of the following are routes of transmission of CMV, that is cytomegalovirus? Option A saliva, option B breast milk, option C semen, option D urine and option E all the above. So the answer is E, all the above are the following routes of transmission for CMV, that is cytomegalovirus. Moving on to our 19th question, which of the following diseases cause fever, blisters and cold sores? Which of the following diseases cause fever, blisters and cold sores? Option A herpes labialis, option B herpetic gingiuostomatitis, option C herpetic keratitis and option D herpes genitalia. So your right answer is answer A, herpes labialis. Moving on to our 20th question, describe the most common appearance of molluscum contagiosum lesion. Option A medium purulent lesion in the genital area, option B large pustules in the genital area, option C facial lesions and tumor like growth and option D small smooth macules in genital area and thighs. So your right answer is answer D, small smooth macules in genital area and thighs. Now moving on to our 21 question, which of the following are possible natural host of varicella-zoster virus? Option A dogs, option B cats, option C chickens, option D humans. So the right answer is option D, humans. Humans only get the chickenpox, right? Moving on to our 22nd question, which of the following is the most important cause of medically attended a acute respiratory illness? Option A influenza A, option B influenza B, option C influenza C and option D avian influenza. So your right answer is answer A, that is influenza A is the right answer, which will be cause medically attended a acute respiratory illness. Moving on to our 23rd question, which of the following is a ubiquitous virus which infects lymphoid tissue and salivary glands? Option A herpes virus, option B adenovirus, option C Epstein-Barr virus and option D pox virus. So your right answer is Epstein-Barr virus, that is EBV virus. Moving on to our 24th question, the varicella-zoster is the most common in which patient? Varicella-zoster, again it's a kind of chickenpox, right? So option A children, option B adolescent, option C adults and option D elderly people. So the right answer is option D, that is elderly people, most common seen in elderly patients. Moving on to our 25th question, viruses are classified according to all the following except what? Option A type of replication, option B structure of virion, option C host required for survival, option D structure of virus. So your right answer is answer C, host required for survival. Moving on to our 26th question, the EBV, that is Epstein-Barr virus, is associated with which of the following? Option A chickenpox, option B Hodgkin Lymphoma, option C Burkitt lymphoma and option D smallpox. So your right answer is answer C, Burkitt lymphoma. EBV is associated with Burkitt lymphoma. Moving on to our 27th question, Darkfield microscopy can be used to visualize what? Option A Pseudomonas Aeruginosa, option B Streptococcus Pneumoniae, option C Treponema pallidum and option D Legionella pneumophila. So your right answer is Treponema pallidum can be used to view under the Darkfield microscopy. Moving on to our 28th question, Cold and acute respiratory diseases are most often associated with what? Option A, EBV, that is Epstein-Barr virus. Option B, adenovirus. Option C, Coxsackie B virus. And option D, reovirus. So your right answer is answer B, adenovirus. Okay, next moving on to our 29th question. Phage virus mediated transfer of host DNA from one cell to another cell is known as what? The process of transferring from one cell to another cell is known as what? Option A, transduction. Option B, transformation. Option C, transcription. Option D, integration. So your right answer is option A, transduction. Moving on to our last question, 30th question. Which is not a DNA virus? So friends, before answering this question, you have to know that what is the difference between DNA and RNA virus, and what are the list of DNA viruses and what are the list of RNA viruses. Then only you can differentiate between both DNA and RNA virus. So your answer is what? Option A, herpes. Option B, HBV, that is hepatitis B virus. Option C, adenovirus. Option D, HCV virus, that is hepatitis C virus. So your right answer is answer D, that is HCV virus. Hepatitis C virus is not a DNA virus. So friends, these are the remaining part 2 15 questions from virology. Hope you like it. So see you in our next video. Thank you.